Okay, here the Chynn is doing the procedure that's Lasek surgery.
Yeah, I think you should call it safe side because
Safe
it
side
sounds,
surgery.
when you say Lasek, it sounds like Lasek, you know.
Okay. This is Park in Lasek. It's the only center that don't flap in all New York City. It's the big difference between that we doing here, that with safety, with Lasik surgery, is that we don't put the cornea. So what I mean with this is that there are big difference between both. So if we don't put the cornea, you don't have any chance that have infection in your cornea. If we don't put the cornea, you don't have any chance that have a problem with the flap. So because we don't make a flap, it's only gonna be 42 seconds.
Keep looking left for 42 seconds. You're doing great.
The patient prescription is -5, and it's only 42 seconds. After this, you're gonna have the best vision. The good thing is that with this surgery, you don't have flaps, you don't have chance that have halos and glare. The reason is because we use high definition here, and with high definition, you want to resolve all the high precision in your peripheral cornea. And if you don't have flaps, you don't have chance that have halos, okay?
Hey, you should also mention yourself. You see what I'm saying? You should be like, okay, I'm from Argentina. My family's a bunch of ophthalmologists. Before I came here, I wasn't so clear about the difference between this and PRK, but now I'm going to explain this to you. You know what I'm saying?
Yeah.
Kind of like the whole Jessica Fleischman thing.
Yeah.
So why don't you talk about it now?
Okay. I am a fellow here in Park Lasek. I am from Argentina. I came here to learn about this technique and bring this technique to my country and try to open my own center that's not flap surgery.
And then you would say how like down there they're all doing PRK. It's not the same thing, you know.
Yes, before I came here, I didn't know the difference between Lasek and PRK, and after I came here, I learned about this difference, and it's two different. Also, we have a fellow senior here that he got his own PRK surgery in Venezuela. And if you come here to free consult, you can talk with him and know the difference between PRK and Lasek surgery.
How do you feel, okay?
Yeah, I feel fine.
That was easy, right?
Easy.
Just stand here. Did it hurt?
No?
Was it easier than you thought?
Yeah, much easier.
Yeah, it's easier, right? Okay.
Yeah.
So, it was like 5 minutes or something, right?
Yeah.
So, how long have you been in glasses or contacts for? Like, how many years?
20.
20 years. Kind of funny where you're in that for 20 years and then it takes 5 minutes, right? I really think the reason that people don't do this, it sounds almost too good to be true, right? I think that might be the reason. Because if someone said to you, hey, do you want to wear glasses or contacts for 50 years? Or do you want to have this done for 5 minutes? You'd be like, I'd rather have this done for 5 minutes. You know? So I guess, but you had to wait for your wife to go first or whatever, right? So.
She was the guinea pig.
Yeah, so usually the girl goes first most of the time.
They're brave,
I think they're more brave. I think there's some cosmetic factors going on because guys do it more for functional reasons. Girls do it for functional plus cosmetic reasons, so they have like another reason to do it, something like that. So, interesting. You're 20. Then what was your original prescription? I forgot. That's high. Okay, so -8. That's right at the limit of Lasik, but because we're not doing a flap, we can go up to like -20. Okay, and then you were pretty bad actually. You were legally blind, right? So you couldn't see the big E, right? So before we started, I guess you couldn't see anything outside except colors and shapes, right?
Exactly.
Okay, so you'll be able to read all these things. A little foggy because we didn't clean the windows, but don't worry if it's a little soft focus. This is not the best vision. Lasik, I did it myself. I did 5,000 Lasiks. You get your final best vision in about a week. okay? But then it stops getting better. So the typical result is like 20/20. The non-cutting safe site procedure that you had done, it was invented at Harvard when I was there, and it takes longer. So you don't really get your final best vision for like a month or maybe even 2 months. But the thing is, it keeps getting better after a week. So typically you'll catch up to the Lasek patient by, let's say, 2 weeks, 20/20, but then you keep getting better. So the typical non-cutting patient winds up seeing better than Lasek than just every one patient, especially in the first week, okay? So you want to open your eyes? You can open your eyes. Hey, check it out. Isn't that cool?
That is cool. I could see the words.
You can see a Greco, right?
Yeah, I had to squint before.
Yeah, you can see the funny sign there, right? Yeah, it's
Great.
good.
I can't.
You can see your wife. Is she more beautiful than ever?
Of course.
Oh, good, man. Good. That's the right answer. Only half of the guys.
Wow, what happened?
Yeah, only half of the guys get that right. They're like, no, she looks about the same. You know, maybe I can see her wrinkles a little bit better. You know. Hey, you want to say hi to your YouTube friends?
Amazing.
Have you had anything on YouTube before?
No.
Oh, this is your first one. Okay. Play around with it. So. Hey,
Okay.
congratulations. You're very
Thank you
well.
very much.
Good job.